Can OSD make dry eye treatment harder? Can ocular surface disease, or OSD, make treating dry eyes more difficult? The answer is yes. OSD affects the surface of the eye, including important structures like the tear-producing lacrimal glands and the meibomian glands, which create the oily layer of tears. This condition often leads to symptoms such as redness, burning, and dryness, which are similar to those of dry eye disease. For patients with glaucoma, the situation can be even more complicated. Many glaucoma medications contain preservatives that can irritate the ocular surface, worsening OSD and making dry eye treatment harder. One major issue with OSD is that it can cause inflammation and damage to the eye's surface. This damage can hinder the effectiveness of standard dry eye treatments, like artificial tears. When the ocular surface is compromised, it may not retain moisture properly, making it difficult for these treatments to work as intended. Additionally, the medications used to manage glaucoma can cause toxic reactions on the ocular surface. This can lead to increased discomfort and inflammation, which may discourage patients from consistently using their glaucoma medications. As a result, managing dry becomes even more challenging when OSD is present. The complexity of treatment regimens is another factor. When OSD is involved, treating dry often requires a multifaceted approach. This might include managing eyelid inflammation, using anti-inflammatory medications, or even considering procedures like punctal plugs or LipiFlow to address meibomian gland dysfunction. This complexity can make it harder to tailor treatment to individual needs. Surgical interventions such as LASIK can also complicate matters. These procedures can disrupt corneal nerves, worsening both OSD and dry symptoms, especially in those already prone to ocular surface issues. This can prolong symptoms and complicate treatment strategies. From the perspective of eye health, particularly in conditions like glaucoma and macular degeneration, managing OSD is crucial. If left untreated, OSD can lead to a decreased quality of life, poor adherence to glaucoma therapy, and potentially worse visual outcomes. Therefore, it is essential to address OSD alongside dry eye treatment for optimal patient care. In summary, OSD can indeed make dry eye treatment harder. It increases inflammation and damage to the ocular surface, complicates medication regimens, and requires more complex treatment strategies. Effective management involves a comprehensive evaluation and tailored therapies that address both dry and the underlying ocular surface disease. Always consult with a healthcare professional for personalized advice and treatment options.